everybody. How are you today? Welcome back to our continuing series of our topics on the Pike County Health Department. I'm joined once again today by Miss Tammy Riley, and today we've got a special guest, is Jackie Cole. He's the Environmental Health Director for the Pike County Health Department. And today's topic is going to be environmental health. I mean, that's really an important thing, and people really don't understand what that is. We want to educate a little bit about what that is, prompt people to be a little bit more vigilant in what's going on. And we also want to talk about what the health department does that most folks don't even know that the health department does to protect people environmentally. So we're going to talk about that. So Tammy, tell us a little bit about the environmental health program, and then we'll let Jackie kind of get into the meat and potatoes of it, so to speak. And then I got a bunch of questions about how they do it, what they do, and all that stuff, and we'll take it from there. So Tammy?
Yeah, public health has like three main focus areas: prevention, promotion, and protection. And most of what the environmental department does falls in the prevention area or focus area. And so when you prevent something bad from happening, most times individuals aren't aware that the service happened to begin with. And that's the case with the environmental department. Much of what they do to protect the residents in Pike County, the residents never know about those services. And they offer just everything from, public swimming pool inspections. Obviously, most people are aware they do restaurant and hotel inspections. They permit and inspect temporary food trucks. They do permitted and inspections for private septic systems. They inspect tattoos.
Tattoos, I know that tattoo parlors are,
piercing.
and I think that's vitally important because, way back when we were growing up, I don't know how old he is, but way back when we were growing
up,
or I should say when I was growing up, because I'm significantly older than you guys, but you didn't see a lot of tattoos, and I've got some employees who have tattoos, and they really want to cover. Right now, tattoos are works of art, and when I saw on this list here of some of the things that you do for tattoo inspection, I don't think people understand the regulations that tattoo. Tanning beds. So, tell us about the tattoo inspections, the body piercing the tanning beds. What do you look for on that?
We look for general sanitation is the big thing that we look for. We're not medical. You do go into the skin, so we're not really looking at medical, especially on the body piercing. We're not looking at a medical issue. We're looking for sanitation. Are their needles clean? Are they using disposable equipment? Do they have good lighting? Is the floors, walls, and ceilings clean? Do they have hand washing, gloves, consent forms?
So how many times a year do you inspect like tattoos?
2 times a year.
So twice a year, and
That's on a regular inspection. But we could have an issue or a complaint.
And so if somebody does say, hey, I got a tattoo and it's swelled up, you guys would go out there immediately. Okay.
Yeah, if they called the health department and we were made aware, then Jackie or someone on his team would follow up with that establishment.
So, you mentioned restaurant inspections, and, listen, the rules and regulations for restaurant inspections are so rigorous, and they have to be. I mean, you mentioned earlier that, if there's Windex close to the washing station, it's a violation. But when we go out there and your employees or your folks who are going out there, we see like a 96 or 97 or 98. Based upon that, I mean, even though they have a couple of points up, that's still recommendations of opportunities for improvement, but that's still not going to hurt anybody, right?
Correct. So the state lists 85% or higher with no critical items as in compliance. So, we know that you cannot be in the process of fixing food and keep it spotless and clean. There's going to be something that drops on the floor.
It's a restaurant.
It's a restaurant. You're making food. You're making pizza. You're going to have flour somewhere. It's just impossible for it to look like a picture. So we would still consider, like, if the floor was dirty, it's a dirty floor, but that's a 1-point item. Right. And I always tell everybody, if you had 100 question spelling test and you missed one question on that spelling test, what would your mommy do with that spelling test? She'd hang it on the refrigerator because you got a 99.
Right.
We don't expect for them to be perfect. Actually, almost, if they are perfect, you have to wonder, is the inspector really looking?
Sure.
Now that's not to say that there's not hundreds out there, but if you had one inspector that was constantly given 100, you would say, no, come on, there's some.
Mostly looking for those critical items.
We're looking more for those items, temperatures.
There was there was a Social Security judge who was constantly giving out Social Security disability payments to people, and he wound up in jail. So yeah, that's a great point that you make. So my point here is another point that I think is really important to make, and it's kind of a comical point, but it's damn truthful. Go on the website for the Pike County Health Department, and it'll list your inspectors.
Correct.
Okay, and look at this man right here. Look at how pretty he is. If you see this man eating anywhere, you know it's a safe place to eat. So follow him around and go spend your money at the restaurant where he's eating, because you know it's a safe place.
I do ask him that frequently. I'm like, where do you eat in this area?
But when you do have violations that are major, there's a time frame that people can do it. At what point do you say to a restaurant, okay, we're shutting you down? You see John Tapper on Bar Rest, shut this place down. What point do you shut it down and start from scratch?
Okay, so it's kind of to tell you a little bit. So whenever you're 85% or higher with no criticals,
right,
then that means you're operating within the guidelines of the law.
Okay.
So solid B scores.
Yes.
If you were looking at like a grade, letter grade system.
But they may have one critical item and have everything else correct. And so we're going to address that critical item immediately. Let's, maybe their food has to be 41 degrees or less. Their cold food. Well, maybe their food is 63 degrees. So we know that spoilage would be accelerated. So that would be an item that we would correct immediately.
Right.
We have 10 minutes to 10 days. And just for an example, like we were talking about the Windex, somebody may have a bottle of Windex that's not labeled. Well, if that's sitting next to a beverage container, you may think that's blue slush puppy mix. So you wouldn't want somebody to pour that onto the drink. In 10 minutes or less, you can write the word Windex, and everybody now knows that's Windex.
Sure.
But if you have a large gap under your back door where rodents could run in and out, you can't fix that immediately.
Right.
You could do a temporary fix where you put some blocking up on it, but it may take you 10 days to order a door and have that door installed.
Okay.
So that's the 10 minutes to 10 days.
10 minutes to 10 days. It's the inspector's discretion. Now, there might be a time where, yes, you could put Windex on a bottle within 10 minutes, but you've constantly marked this place on this. Right. You may give them a 2 or 3 or 4 or 10-day notice to make sure you're keeping them. They don't know when you're going to come back. So you try to do your best to make them stay in compliance and be watching for you on that. When do you shut a place down? When the score, immediate shutdown would be when the score is 59 or less.
Okay.
Which would be, if you're using school analogies, that would be an F. If they have a 69 or less, we issue them a notice of intent to suspend their permit. And so what they have to do is they have to fill out paperwork and send it back to us, and then we would have a conference with one of our state partners, and they would come in. I would present my findings. They would present maybe what they've corrected or where they feel that I was wrong in writing that up at.
Right.
And our hearing conference officer would make the decision to allow them to continue or to possibly close for an amount of time.
And how often are you doing restaurant inspections?
We do them at least every 180 days.
And then
at least
those restaurant inspections are posted not only in the News Express, but also they're posted on the website. So anybody can go to the website and say, "Hey, I'm thinking about going to ABC Restaurant, and I want to go in there and see if that's a legit place or if they've had any violations or anything like that."
Correct. Now, in the paper, though, what we do is we only list the items that are critical.
Right.
So you may see, what was the Bubba's food store, and you may see that they have a 95 and there's nothing written below that. Well, obviously, we got them on a couple of items, but we can't list every non-critical item. Right. However, you might see that their score was an 86, and it might say employees involved in food prep wearing race-set rings. Those race-set rings can hold bacteria in them, and so that tells you what that critical item was. Gotcha. If we corrected it during the inspection, we told them they can't. We educated them. We said you can't be wearing rings. Then we may say on the inspection report, and you would reprint that, inspected at time of inspection, followed up at time of inspection. But sometimes you'll notice in there it has follow up. And then you'll have just the names. That means we gave them a little bit longer than 10 days to correct that problem.
And we keep that food news as well. Like you print it for us when Jennifer Lowe in Jackie's department emails me the food newsletter. The first thing I do is send it to you guys at Appalachian News Express, and then I have it posted on our webpage. But they're archived there, so people can
So
go.
people can see that over the years and so on. So food inspections are great. Tattoo inspections are really good. That's a lot of public safety. You mentioned septic tank, mobile home park inspections. You're doing all those things, and public swimming pools and all that stuff. What, as the average consumer, as the average Pike County person who, lives in Pike County, works in Pike County, pays their taxes in Pike County, what would you say to them as far as what the job is that your department, your part of the health department is doing on how they could protect it? If you could sum it up in like less than, a paragraph or two, tell me what your team does and how you are vigilantly not only doing what you're doing, but how you're continuing to do things to make people safe.
So education is key. On your list, you may know, so we have a certified pool managers class. So we teach the people about that, but we do food handlers, food managers classes. Anytime that, we've spoken before the Rotary, we've spoken to, different organizations, quantity, so we try to keep them updated and educate them. So education may be in the form for us to a pool manager, how to keep the chlorine correct. It may be to the restaurant manager, how to ensure that you're not having a foodborne illness. It may be to a school, hey, we have the flu's going around, so we need to make sure you have just soap, the paper towels, hot and cold. They're supposed to have hot and cold running water, soap, paper towels, but we may enforce that with them.
And speaking of schools, our environmental department, the school boards and the school systems are great partners, and we do work with them and inspect schools.
Yeah.
So like during flu season, as Jackie was saying.
Yeah, we inspect them. Also, I've even spoke at. I went across the county a few years back and talked about reduce, reuse, and recycle. So we, the environment. We only have one environment. We only have one planet, and we get one chance to save it.
That's an interesting point. I was riding around the other day, and I was at a function, and I have all my cardboard that I'm recycling, and just so happened that I had an empty 12-pack of beer cardboard and like thing there, and I saw a state trooper, and I said, "Do you need a ride to go where you're going, trooper?" He says, "No. Do you got a cold one in there?" I said, "No, sir. I'm going to recycle." He said, "Sure you are."
I've seen you over there.
I'm solid. I recycle all the time. So I encourage people to do that. There's recycling places all over, and I really encourage people to do that because it's really important. So here's, we talked a little bit about other things. This is the time of year where snakes come down out of the mountains. You got critters running around. What happens if you get bit by an animal here? What should the Pike County Health Department be part of that emergency health care plan? And what should people do if they get bit by a snake, or they get bit by a mongoose or a cicada or whatever the heck's out there biting people?
I did hear cicadas this morning, but I'm not sure about the cicadas. I'd let Jackie address that. But I would say absolutely they would want to touch base in most instances, and I'll let Jackie expand on that. I could talk on this topic, but I'll let Jackie.
So yeah, any animal bites, if it requires an ER visit, then the ER would report that to the health department.
What would require a visit to the emergency room?
A parent or an individual that was worried about the bite. Typically, whenever someone's bit, they'll give them typically a tetanus shot.
Right.
But the ER or the doctor's office would refer that bite to the health department.
Okay, good.
But they're required to do that within 24 hours.
Okay.
But an individual that didn't go to the hospital or the ER, the doctor, they should still call the health department, because we quarantined the animal that bit them for a period of 10 days.
What happens if I'm out running around and I get bit by a snake and I go to the emergency room? Is it advantageous for me to try to whack that animal on the head and bring it with me to the health department?
Yeah, absolutely.
Well, we would say on a snake, that is a different. For rabies, it wouldn't be snake, but cat, dog, raccoon, skunk,
not a possum,
a bat. But you said whack it on the head. We want to keep its brain intact.
Okay,
That's where we would study for rabies at.
Okay.
So we would have Dr. Collins
Joey, right?
take care of
Sure.
of getting the the part of the brain that needs to be tested for rabies.
Sure.
Rabies is what we worry about at the health department. Like I said, we were going to quarantine that animal. The best thing to do is to allow that animal to live for 10 days. If that animal can live for 10 days, then we know you're safe from rabies. But sometimes people will kill the animal and they'll injure the brain.
Sure.
We can't test an animal that has an injured
And
brain.
it's not necessary to harm the animal.
Right.
If you have the animal alive, we just need to quarantine it. And a lot of, especially as dog owners and cat owners, they love their pet and they know their pet's vaccinated, number one. And the animal is alive. All the environmentalists need to do is, there's a misconception. They think that Jackie or his team's going to come out and take their animal,
Right.
take it to the animal shelter or euthanize the animal. And that is simply not the case. We just need to quarantine the animal for 10 days. They can do that in their home, the owners of the animal. And then we go back in 10 days just to ensure that the animal is alive. And then we can proceed with giving good direction to the individual impacted by the bite.
But the bottom line on that is to make sure that your pets are vaccinated and are up to date on their shots.
That is the outcome.
Please, for crying out loud, get your animals spayed and neutered. We don't need any more mouths out here.
That's where you get into trouble is strays. So
Yeah.
if there's a stray, there's a bot and it's bad enough that, they go to the ER or it's reported to public health, then we don't have access to the stray. So there's no way to monitor. There's no way to test. That's when rabies vaccines come into play. So a lot of people, there's just misconception and fear about what's going to happen to their animal. And then also, do I need to get a rabies vaccine? And sometimes people get vaccines when it's not necessary.
Yeah. So if they have questions, the first thing they do is call 911. The second thing they do is, if they have questions afterwards, go to the Pike County Health Department's website, right? Or they call us. The number is, Tammy?
606-509-5500. And we do have 24/7 emergency after hour answering service. So something like a serious animal bite was involved, we would get that call after hours.
And also, like you said before, if you find a restaurant is not doing good, or if you find something needs to be looked at, if you have, an infestation or a bad sewer smell, call the health department. They'll send people out there. Jackie's team will go out there. They'll look at it. They'll investigate it. And, the community has to be vigilant. They can't be everywhere. 674 square miles. They can't be everywhere. That's why they rely on the community. That's your tax dollars that are paying these folks to make sure that we're all safe. And if you see something, say something. Pick up the phone, call the health department, report it, let it go, let it get them on record, give them an opportunity. Guys, once again, I really appreciate your opportunity. Thank you so much for your time. Jackie, it's a pleasure to meet you.
You too.
As always, it's good to see you.
Mr. Van der Beek.
Thank you, guys.